Welcome everyone to this month's Liverpool Dementia and Aging Research Forum during Dementia Action Week. And we are welcoming today Dr. Rich Foster, who is a senior lecturer in biomechanics at Liverpool John Moores University. And he will be talking about his research and work into falls in older adults in the home environment and how to reduce and hopefully avoid them as well. So throughout the talk, we've had over 200 registered people, by the way, so hopefully those people will join us throughout. So throughout the talk, please post your questions as usual in the chat box, and we'll pick them up towards the end. So we'll have about 15 minutes of a Q&A at the end, where you can ask your questions to Rich and he will answer them. And also, if you are using social media, please on Twitter, use the hashtag Liverpool Dementia to tweet about the event. But I hope you'll enjoy this. I hope it'll be informative, and over to you, Richard.
Thanks, Clarissa. So yeah, I'd just like to start by thanking Clarissa for the invitation to talk about my research in this forum, and thank you all that are live or listening to the recorded session for joining today to listen to the talk. I was particularly pleased to learn from Clarissa that today's audience comes from a variety of backgrounds, such as health and social care professionals, people living with dementia, and carers and academics. I work in the Research Institute for Sport and Exercise Sciences at Liverpool John Moores University, where we have a fantastic research facility that enables us to carry out research investigating fall risk in older adults. Before I begin my talk on how we can change the environment to reduce fall risk in older adults, I just wanted to share with you what our institute leads on a variety of research projects in sport and health and clinical applications, working in a fantastic research environment. Some of these projects include exploring the effects of high intensity exercise on individuals with and without pathology, so understanding how cardiovascular risk factors are affected. We devise strength and conditioning programs to optimize performance and reduce injury in elite athletes. We're also involved in advising jockeys and the British horse racing authorities with respect to weight making strategies in a healthy and sustainable way. And we also measure brain activity to better understand behaviour. So that's just a little overview of what our research institute is all about. My particular expertise are in biomechanics, which put simply is the study of human movement. I have a particular interest in the biomechanical mechanisms that lead to falls or increase the fall risk, especially in older adults. I'm extremely lucky to be part of an excellent team of academics, postdoctoral and postgraduate researchers that carry out research to improve stair climbing safety, or research to improve stair climbing safety. And we also assess falls in a variety of other contexts as well. On the right of your screens are the team that I work with, but on the left and in the middle images, these provide you with an insight of how we model people when assessing movements in our lab environment. Our purpose is to determine how and why falls occur over ground, over obstacles, and on steps and stairs, and we develop methods to reduce or prevent these types of falls occurring. I'd now like to provide you with some context regarding why falls are so important. Falls are a significant worldwide health issue. The World Health Organization reports that approximately 684,000 people, or 684,000 falls, occur on a yearly basis, with adults older than 60 years of age suffering the greatest number of fatal falls. There are significant consequences to falling, unfortunately, including fatality, traumatic brain injuries, and hip fractures, which ultimately lead to long-term healthcare implications. Alarming healthcare costs are associated with falls, with an estimated £2.3 million spent in the UK alone. And in the US, this figure is significantly larger due to the healthcare system, with $616.5 million for fatal falls, alongside $30.3 billion for non-fatal injuries. So these costs are really significant worldwide. Understanding how and why people fall is part of the process of understanding what we can do to intervene and reduce the fall occurrence. So why do we fall? Well, first, a fall is defined as an event such as a trip, a slip, or a stumble, which results in a person losing their balance and coming to rest inadvertently on the ground or the floor. There are many reasons why falls might occur in older adults, and these include intrinsic factors, which are the physiological attributes of the individual, such as reduced lower limb strength, decline in visual function, or behavioural aspects or behavioural characteristics, such as carrying loads or becoming distracted. Often the factors are linked, so a person might reduce their activity levels as they get older. In turn, because of this, their muscle strength and balance reduces and puts them at an increased or a greater risk of falling. If they experience a fall, they might develop a fear of falling, which subsequently leads to even less activity. So the process is cyclical. I'm particularly interested in the extrinsic factors that affect falls, such as the built environment and its appearance. This is because when we walk or we move around our environment, we typically use our vision to guide our movements, and so it's important when and where we look. If we take a closer look at the image on the screen that I've just shown, there are multiple environmental risk factors which may contribute to falls in older adults. These can include pets, rugs or loose mats, slippery surfaces, stairs and stairs with clutter on them especially, and inadequate lighting. So the cause of a fall is frequently an interaction between the individual themselves and the environment that they're in. And we know, based on previous research, that vision is used in a feed-forward manner, and we usually look approximately 2 steps ahead along our travel path to plan safe and effective movements. But an inability to do this can have serious consequences. Using our vision in this feed-forward manner allows us to take evasive action when faced with a risk ahead of us. So, for example, we could change our travel path, we could alter our stride length or our stride width, or lift our foot higher to avoid an accident. However, we can run into problems when faced with circumstances where the environment is unclear or ambiguous. So I want you to consider the example in the left image on the screen, where the initial impression of the travel path ahead is that you're about to walk down a slope because the textured surface makes it appear that way. In reality, you're faced with a series of steps to descend, and the implications can be very serious if we're not expecting that. In this next image, at first glance, you could be forgiven for thinking that something very bad has happened to this cat, but in reality, the upper and the lower surfaces are difficult to tell apart, so that it appears to be a level surface, when in reality, the cat is sat behind a step. Other examples related to the appearance of the environment can include surfaces that are not uniform, that are uniform in colour, and misplacement of edge highlighters and weathered conditions. And as you can see in the series of images on the screen, patterned surfaces are also dangerous. The surface can sometimes, in this situation, the surface can sometimes look like it is uneven or it's undulating, and this is likely to impact how you move through the environment and how you place your feet in front of each other. Now you'll notice that many of the examples I've shown relate to steps and stairs. And that's intentional because we know that falls in general are an important issue, but I want to draw particular attention to the serious nature of falling on steps and stairs. Stair falls are a significant burden to the NHS because they occur regularly and they lead to long-term care with increased admissions to care homes. According to the Royal Society for the Prevention of Accidents, 53,000 or approximately 53,000 people attend the accidents and emergency services each year due to a fall on steps and stairs in the UK. And from 2019 to 2020, around 63% of all stair fall hospital admissions in England occurred in those aged 60 years and above. And incidentally, when we refer to an older adult, typically we're talking about individuals that are 60 years or above. And in the US, there are approximately 1 million falls on stairs per year. Now, in each of these videos, you may notice that there are several factors contributing to the fall, such as the speed of the movement or the fact that the individual seemed to be carrying an item. And it's also likely that the appearance of the environment contributes significantly. So now I want to talk to you about fall mechanisms on steps and stairs. So there are several mechanisms responsible for a fall occurring on steps or stairs, but two particular mechanisms that I wanted to share with you today are inadequate foot clearance and increased foot overhang. Considering foot clearance first, if you don't lift your foot high enough when ascending a step or stairs, you're likely to experience an accidental foot contact and fall forwards. If you don't clear the step or the stair edge during, you're likely to fall forwards. And if you don't clear the step or the stair edge during descent, you are likely to scuff the heel on the step or stair and fall backwards. Foot overhang is when some part of the foot is not in contact with the step or the stair surface, which reduces the contact area for supporting your body mass during ascent and descent. Thus, with more of your foot hanging over the edge of the step, you are more likely to slip off the edge or the surface and fall. And with these fall mechanisms in mind, our research team have spent a number of years addressing ways to reduce these risky behaviours on stairs by altering and improving the visual appearance. In a previous study, funded by the National Institute for Health Research, whilst I was working as a researcher at the University of Bradford, our team investigated the presence and location of edge highlighters, step edge highlighters during stair descent. Now consider that you're standing at the top of this staircase. It appears that the white lines give the impression that the edge of the step is located at the front edge of the white line. So the white line is being used to determine or delineate the edge of the step. But as you can see on the right image, the actual location of the edge highlighter is set back by approximately 30 millimeters. So in the left, it appears that the white strip defines the edge of the step. But if we look closely, the edge highlighter, as shown in the right, is set back from the edge. And we demonstrated that this can lead to dangerously low foot clearances, less than 5 millimeters, which gives you an increased risk of an accidental foot contact with the step edge. And we tested individuals whilst we also simulated a cataract blur. So we reduced their contrast sensitivity, their ability to observe contrast, and reduce their visual acuity as well. And we found that they were at an increased risk of an accidental foot contact with the step edge. Now, the important message here was that edge highlighters should be present on steps and stairs, but importantly that they should be located at the very edge to clearly delineate where the step or the stair tread finishes. Ascending stairs can also be very dangerous, so going upstairs can be very dangerous too, where individuals misinterpret the height or location of step edges. To address this issue, we've adapted an existing optical illusion that alters perception and used it to modify stepping behaviour. Before I explain this in more detail, first it's important to say that visual perception refers to the brain's ability to make sense of what the eyes see. A nice way to understand how visual perception works is through the use of some example illusions. So every which way you look at the image on the screen, the individuals always appear to be walking or moving up rather than down the steps or stairs. This next example is called the rabbit-duck illusion, which is an ambiguous image where a rabbit or a duck can be seen, and this depends on which part of the image you choose to focus. So if you chose to focus on the left-hand side of the image, it's likely that you'll see a duck, but if you choose to focus on the right-hand side of the image, it's likely that you'll see a rabbit. In this video, similar to the rabbit-duck illusion in the previous image, some may find it difficult to determine whether the animal is a rabbit or a crow. But I can assure you it is a crow, in my opinion. And then here we have the Muller-Lyer illusion, and this gives you the impression that the length of one line is longer than the other, and this is based on the directions of the arrows or the direction that the arrows are pointing, when in fact they're both the same length. So really the purpose here is to show how the appearance of things can influence our perception. In previous slides, I've already shown you how appearances can be detrimental to behaviour and contribute to fall risk. But next, I want to show you how it can also have a positive impact on our behaviour as well. So this is the horizontal vertical illusion, and we've been applying this illusion to reduce fall risk over steps and stairs. The basis of the illusion, the horizontal vertical illusion, is in this simple design shown on the screen, where the vertical and the horizontal limb lengths are equal, but the vertical limb appears to be approximately 20% longer. So I'll just take that back a step and just let you have another close look. So the basis of the illusion is this simple design, and it's where the vertical and the horizontal limb lengths are equal, but the vertical limb appears to be approximately 20% longer. And this is based on the idea that the two limbs, or the two limbs are intersecting each other. If they were separate, then the illusion would disappear. So as in the previous examples, this illusion tricks us by altering our visual perception. But we wanted to know whether placing this type of illusion on the face or the riser or the front of a step or a stair could alter how tall the step or stair appears. So based on the theory that perception can alter our behaviour via what's known as a perception action coupling, we predicted that individuals would lift their foot higher over a step or a stair edge if a version of this illusion was present. The first thing we needed to do was adapt the illusion for stair use. And through a series of linked studies, we have developed a number of effective stair versions, one of which you can see in the video. So in the video, what you see is an older adult walking up our lab staircase. It's a 7-step staircase with the stair illusion positioned on both the entry and the exit of the stairs. And this is where stair falls commonly occur. They do fall in the middle of the staircase, but they often occur during the entry and exit of the staircase. The stair version of the horizontal vertical illusion is comprised of a single edge highlighter that runs across the tread edge and a series of vertical black and white lines that are placed or positioned on the riser. We know, based on running a series of computer-based perception tests, that both young and older adults perceive steps to be taller when this visual cue is present, compared to plain steps or steps with other types of arbitrary patterns on them. We've superimposed this illusion onto single steps and stairs with up to 7 steps, and we've also modified the number of black and white stripes and tested it on young and older adults. So in this image here, you can see both a very simple version of the illusion and a complex version of the illusion. One has a single vertical stripe and one has up to 12 black and white stripes. Our findings indicate across 3 published stair studies that foot clearance increases by approximately 1 centimetre when individuals are crossing the step edge where the illusion is present. And this significantly reduces the trip and the fall risk. So in the video that you saw at the beginning of this slide, participants would increase their foot clearance over the first step at the bottom and the top step at the end by approximately 1 centimetre, which reduces that risk of a fall occurring in the entry and exit to the staircase. Importantly, our findings are not limited to steps and stairs. When individuals were challenged with crossing obstacles that typically represent the height of a UPVC door frame threshold that you find in the home environment, we found similar increases in foot clearance for both limbs of approximately 1 centimetre again. So when you're entering the home or exiting the home, whether it's through a front door, a side door, a back door, the presence of a visual cue such as this could be a great help in avoiding a fall occurring. We've also been able to demonstrate recently that the presence of our stair illusion placed on inconsistently taller mid-stair risers can lead to increases in foot clearance. So this is important since a previous study identified that this type of step inconsistency, so a taller mid-stair riser than the rest of the steps, can often go visually undetected, which is part of what you see in this first video. So consider that these individuals are walking up a long flight of stairs and all the steps are the same height, but one particular stair riser or step riser is higher than the rest. And it's particularly interesting to note that on this occasion, a yellow edge highlighter is not enough on its own to avoid that trip incident occurring. So we even captured an accidental trip in the middle video whilst testing people's responses to the step inconsistency in our lab environment. So we were able to alter the height of the stair riser in our 7-step staircase and assess people's responses to that increase. So whilst the steps before and after that 3rd step were consistent, step 3 was inconsistently taller by about 1 centimetre. And here we see that accidental trip occurring. Now, the obvious solution would be to adjust the physical dimensions of the stairs. And that's okay in a lab where the stairs are adjustable, but it's not the case when you're faced with a real world circumstance. So what I'm trying to say is a stair rebuild is quite complex and it's quite costly. In contrast, our visual cue provides an effective and cheap solution instead. We found that the presence of the stair illusion increased foot clearance by an average of 1.1 centimetres, which offsets this reduction in foot clearance caused by the inconsistently taller stair riser. So where you reduce your foot clearance over the taller stair riser in the middle of the stairs by around about 1 centimetre, we were able to offset that reduction by the presence of our visual cue. Now, to link to the next study that I want to show you, these visual cues we've designed and developed show great promise, but they're not going to be useful in the home environment if the home user can't see them when moving around the environment. So what I mean by this is that we need appropriate lighting, and appropriate lighting is an important factor in the home environment to ensure safe movement and making use of these visual cues. Now consider that light bulbs only tend to get changed when they break. So this can take months, sometimes years in certain parts of the home to replace. Importantly, some people still use compact fluorescent light bulbs in their home, and these light bulbs take some time to warm up and produce enough light. And they can be particularly dangerous if used in the hallway or landing by steps and stairs. For that reason, we previously investigated the effects of real-world bulb illumination on stair descent in our stair lab. In the two images, you can see the difference between a high-powered LED light bulb, where you're able to determine the features of the staircase, and then a compact fluorescent light bulb during the first 2 to 3 seconds of being switched on, where it's much more difficult to determine the features of the staircase. So clearly it's quite challenging to determine the features of the stairs in the low lighting condition. And if we couple that then with potential declines in visual function due to the aging process, such as poor visual acuity and reduced contrast sensitivity, it becomes even more difficult and very challenging. So in our study, led by researcher Dr. Neil Thomas, we found that the compact fluorescent light bulbs led to more cautious stair descent in young and older adults, including slower walking speeds and increased foot clearance, because they were unsure where the step edges actually were. But we also saw riskier stepping patterns as well, and these were exhibited again in young and older adults when using the compact fluorescent light bulbs. Foot clearance variability was also increased, and this increases the risk of catching the heel or the toe on the step edge. So in summary, in terms of optimal lighting levels for stair safety, compact fluorescent light bulbs at first turn on lead to less safe stair negotiation, and I'm pleased to say that compact fluorescent light bulbs are not sold frequently on the shelves anymore. And then safer stair descent was observed with bright light LED light bulbs, and so these are preferable for use over stairwells in the future. In the previous slide, we saw how bright light enables better visual detection of important stair features. And here we demonstrate that the choice of stair decor can impact safety in both young and older adults. In this preliminary study, again led by Dr. Neil Thomas, we assessed a variety of stair decors, which included a plain grey surface, a black and white pattern, and a multicoloured stripe pattern. And again, we tested this in young and older adults. So here's a video of what it looked like to descend with the busy black and white pattern condition. So participants were wearing an eye tracker to capture where they're looking whilst descending the stairs. And we can clearly see in the video that the person is looking down throughout stair descent. So they're not actually looking ahead to plan their movement effectively. And this is a risky behaviour in itself. What you may also notice is that it's really difficult to determine where the step edges actually are unless you really focus your visual attention. We can assess where people are looking by following this green gaze vector on the screen. So they're looking down at the feet, they're trying to locate the step edge as they navigate the staircase. So we found that the patterned stair surfaces, compared to the plain condition, they increased participants' anxiety in both high and lower ability older adult groups. And the plain stairs appear to increase foot clearance for young adults and higher ability older adults, but not in lower ability older adults, which is worrying. The inclusion of edge highlighters for each stair decor condition, such as the edge highlighters you saw earlier on in the presentation, they actually increased the participants' confidence and they reduced anxiety for all groups. Plain stairs with edge highlighters present appeared to improve foot clearance in higher ability older adults. But this was not the same for lower ability older adults, which worryingly suggests this group were unable to adapt to the visual properties of the stair surface. So though the majority of our work is focused on investigating high and low ability older adults so far, there is existing evidence that visual modifications to the environment can benefit older adults with Parkinson's disease. So a series of studies led by Dr. Lisa Alcock, who's a great friend and collaborator of mine based at Newcastle University, investigated the differences between people with and without Parkinson's disease. Lisa and her team reported that visual cues can improve visual search strategies when moving through an environment, and this is by focusing their visual attention on important features of the upcoming environment, such as an obstacle that they have to cross. And Lisa also showed that the shape of an oncoming obstacle can act as a visual cue. And this ties in with how physiotherapists train people with Parkinson's disease to use visual cues in the environment, as they have been shown to be effective in reconfiguring the spatial scaling of movement. Lisa also found, with her research team, that increasing the contrast of an oncoming obstacle can improve how people with Parkinson's disease use their vision in a feed-forward manner to plan their travel path through the environment. Now, Lisa is part of a research group at Newcastle University Brain and Movement Group that investigates neurodegenerative diseases such as Parkinson's and dementia. And we know that falls are a serious issue in these groups of people, and that the home environment is a large focus in making sure that people can live an independent life for longer. Therefore, we are looking at ways to use our visual cues on hazards in the home in the future to help this objective. Considering each of the solutions I've presented today, we're now well placed to assess the feasibility of modifying the home environment with our visual cues. We're currently funded by the Liverpool Clinical Commissioning Group to devise an intervention to reduce falls in the home environment. And we're working closely with 14 specialists across the Liverpool City region. And we'll be working alongside community-based occupational therapists and physiotherapists to complete a home environment assessment that informs future visual modifications of the home to complement the existing practice. Encouragingly, there's existing support for the benefits of improving the visibility of fall hazards in the home. And this is from a previous study in New Zealand, which reported a 26% reduction in the annual rate of injuries caused by falls at home in response to low-cost home adaptations. So these adaptations included adequate lighting and improving the visibility of step and stair edges with things such as step edge highlighters, and cost around £290 per household. So that's really encouraging that something like our visual cue could be added to existing findings such as this one to help reduce falls in the home environment. To make sure we address the features of the home environment that pose the greatest risk to falling and near falls, we've launched a survey that is currently live throughout the UK. So if you're age 60 or over or know someone who is, please consider completing the survey for us. That will help us to improve our understanding of the hazards in the home environment. I'll post the link at the end of the presentation, hopefully, so that you're able to access it and share the link. I'll also pop it up at the on the final slide of the presentation as well. So far, we've received nearly 200 responses, which is fantastic, but we would like a lot more. So any help we can get in sharing the survey would be fantastic. In terms of key findings so far, our data indicates that 32% of people taking part in the survey have experienced a fall, and 25% of people have experienced a near fall in the home environment. In terms of what this means, approximately half of the falls and the near falls occurred on indoor or outdoor steps and stairs, with most people citing that they misjudged the step or the stair edge. Therefore, we believe that the visual cues we've developed will be helpful in the home environment, and we look forward to working with the falls teams across the Liverpool City region to implement these. So to summarise, in this talk, I provided you with an overview of ways we can use visual cues to modify the home environment and reduce fall risks in older adults. These include improving the saliency of obstacles, steps and stair edges, and that's using edge highlighters and high contrast colours. Altering someone's perception of the height of an obstacle, a step or a stair riser using our novel stair illusion. And making sure there's adequate lighting in the home where hazards are present. And we continue to build on this work with several projects ongoing. In the near future, we'll be addressing how our stair illusion has the potential to reduce falls on stairs in the public environment. And with this in mind, one of our researchers, Timian Skirvin, has devised a novel device that measures foot clearance over step edges. In future, we believe that this will allow us to address falls in a public setting, such as in the video that you see on the right-hand side of the screen, not just in the home environment. So we're looking to make sure that our visual cues can be used both in and out of the home environment. So I'd just like to finish by thanking you for listening today and acknowledging those who contributed to this body of work over the past 9 years, and that is the individuals that you see on the screen. But also a special thanks to the National Institute for Health Research, to Liverpool John Moores University, and to the Liverpool Clinical Commissioning Group for funding this work over that period of time as well. So I promised I'd leave you with the survey link at the end. I think that now draws to a conclusion my talk, and happy to take any questions.
Thank you very much, Richard. That was really interesting. Yeah, and I suppose we are the Liverpool Dementia and Aging Research Forum, so sometimes it's nice to hear something specifically on the aging processes as well. And we're really trying to get a broad understanding of what it means to age and to live with dementia. So that's been really interesting. Thank you. And I'm also picking up what you were saying in terms of you working with occupational therapists and physiotherapists. That's really nice. And I've done home assessments myself in the past, and it's nice to have that multidisciplinary involved in your work. That was great.
Thank you.
So we've got a few questions, and everyone please post your questions and we'll pick them up as we go along. So one question from Lisa to you, Richard. Has your research identified the most effective exercises to increase safety on stairs or reduce falls on stairs?
Sorry, you cut out slightly there. Was that exercises to improve?
Yes.
Okay. So So in previous work, we've actually looked at which joints, so which parts of the body contribute the most to effective stair negotiation, whether that's walking upstairs or walking downstairs. And we know that the ankle, knee and hip joints have a large role in the way that we move up and down stairs and cross obstacles. So strengthening those joints and improving the range of motion, and improving the range of motion where we can actively use our strength to be more cautious or more controlled during stair negotiation, has shown to be effective. My particular research doesn't look at strength training programs itself, because we know that it can be quite difficult to get people to adhere to those programs over a long period of time. So I'd like to think that the work that we do to manipulate the visual appearance of the environment could complement or supplement training programs or exercise programs that exist out there. And certainly, whilst we've been working with the occupational therapists and the physiotherapists, we can certainly see how it's multifaceted. So we could introduce our visual cues to the home environment whilst they're also receiving strength and strength training exercises, and look at the added benefit of both in combination rather than separately. But certainly my experience is not in that particular field. But yes, there's a lot of research looking at the contributions of the ankle, knee and hip, and improving the strength around those joints to reduce the risk of a fall.
Okay, great. And we've also got a few questions specifically around dementia. You've mentioned Parkinson's earlier as well. So so from Jackie Cannon, we've got questions surrounding Lewy body dementia specifically. So people with Lewy body dementia struggle with visual perceptions. So how do visual cues work for them to reduce those fall risks in the home environment?
Yeah, it's a really good question. I won't sit here and pretend to be an expert in dementia and dementia subtypes. So I can't say specifically what the answer to that question is. What I can say is that the team up at Newcastle with Lisa are doing some amazing work that investigate these types of things. And what we do know in some subtypes, such as Parkinson's, and I mentioned this in the presentation, is that visual cues can actually draw people's attention to the hazards of the home environment that they wouldn't necessarily take into account previously. And that's in individuals that do and don't have good vision or adequate vision, should we say. So we think that visual cues could be used to benefit the way that we move around the home environment, and then hence why we're trying to pursue that line of work, Lisa and I, in future collaborative work. But yeah, I couldn't give you the specific details of whether it would definitely work or not yet. I'm hoping to answer that in the near future.
Yeah, maybe there's a specific research angle there for you looking at Lewy body dementia.
Definitely.
Yeah. So also some interest in the paper that you were referring to, but you'll see the questions afterwards as well. And then from Natalie, I understand the focus and research in the home environment, but in relation to public staircase examples in the edge highlighter, isn't it stipulated in building regulations for highlight edges to be right on the edge of the step, brightly coloured? I don't know, do you know anything about that, Richard?
Yeah. So yeah, the building regulations state that an edge highlighter that's sort of like the 5.5 centimeters or 55 millimeters thick should be placed along the step edge. What you tend to see historically is that some edge highlighters are actually, rather than the visual appearance of the highlighter, it's the tactile feedback that you get back from it that's important. So in the past, people have placed friction strips along the edge of step edges, and that's what you saw in the image that I shared with you in the presentation, that actually it was there to give people feedback on where their foot's placed relative to the step, rather than to visually take in that information. And so you then have a mismatch between what you feel and what you see. You see that the edge highlighter is placed at the edge of the step when in fact it's not, but you feel where the step edge is well based on the tactile feedback you get from the friction strip. So that's more of a historical issue, and that paper was published in 2014. But we'd hope that building regs have improved since then, and that, you know, the specification is that all steps should have an edge highlighter placed that's a butt in the edge of the stair tread, to make sure that it clearly delineates the step edge and not and doesn't misguide people.
Mm-hmm. Yeah, and we've got a couple of questions on well, stair rails, but also on different settings. So one question is about what difference do stair rails on either side make?
I think it's important that we have. So I'm presuming we're talking about handrails here as we walk up and down the stairs. It's important that we have handrails accessible for everyone that wants to walk up and down the stairs. But the important thing that I don't think has received enough attention in the field of stair falls is actually the position and the location of those handrails. So are they high enough or low enough for the stair user? What shape is the handrail, and is that easy to grasp? So I know that there's some really good work coming out of the Toronto Research Institute with some people that I've been in touch with in the past for research related matters, and they're doing some excellent work. So Dr. Alison Novak over there and her team, Dr. Vicky Commissar and Philippa Gosine, have been investigating how, you know, the handrail shape, the form, the material can affect stair users' ability to grasp it when they're perturbed on stairs. So they actually have a really cool simulator, and when they're stood on the staircase, the whole environment can move and cause them to sort of lose their balance on the stairs. And the natural thing to do in that circumstance is to reach out and grasp a handrail that's closest to you, and the position and the orientation and the shape of it can affect how successful you are at doing that. So it's really important, and I think obviously for some individuals that may have have a certain limb dominance, so maybe they have their left limb or right limb dominant, obviously that will matter where the handrail is placed. And some people might also have a hemiparetic limb depending on their pathology, so that can also affect how successful they would be if they needed to reach for the handrail. So it's vitally important, and these things should be assessed in a home environmental assessment to make sure that it's adequate and that they're able to move up and down the stairs safely.
And I would echo that question from Justine. I wonder if the team, or if you have found any resistance from older adults to having these types of adaptations in their homes.
Yeah, that's a great question. Thanks, Justine. We visited several older adult forums across Liverpool, and we've spoken to a lot of individuals about what they might find acceptable in the home environment if these visual modifications were required, or if we were to say we advise these visual modifications were placed in the home. And really that's formed the basis of a lot of the work that postgraduate researcher Timian Skirvin has been working on over the last 3 years. We were conscious of the fact that the original design wasn't aesthetically pleasing. So a lot of vertical black and white lines on your stairs or on obstacles in the home might not be the sort of environment that you envisaged in previous years. So we've really worked hard to make sure that we alter the number of black and white lines, that we alter the appearance of the illusion, so that we can have a range of different options. For people that don't necessarily like the idea, we could go for just a single stripe, and we know that that's effective. We know that it's more effective when you have more black and white lines, vertical lines on the step, but it still is effective with a single black line in the middle of the riser. So for those that weren't particularly keen to go for the higher striped version, we could look at a lower striped version and make sure that that's something that that they're able to modify in the home environment.
Mm-hmm. And I mean, we're talking about older adults here, and some people at some point may have to enter a care home setting, mm-hmm. and then for them, that is their home environment or sheltered housing, for example. So are there any implications for those larger settings of what people then call home for care homes or sheltered accommodation?
So I think, yeah, so the most of the research that we're doing at the moment considers those that are living independently in community, or the community dwelling, should I say. But for care homes, I think one of the key things we found when doing our sort of preliminary research is that there are changes to surface levels and there are stairs in these environments, but they're often not as common as hazards that you'd find in the community dwelling environment. So, and that's the same for housing associations that build specific accommodation for people that are looking to move out of their own home. So there might not be as many options to superimpose our visual cues in that environment, but certainly I think it would be great to be able to explore the feasibility of doing that. Things like lighting, for example, are a really good option to assess in a care home environment to make sure that adequate lighting is available. Things like spacing, so you'll know from your research that the dementia-friendly homes will talk about how we can make sure that we reduce the number of hazards by improving the amount of space between furniture, cupboards, door frames, and so on. So I think that there's definitely room for us to do this. But obviously there are some challenges that go with that as well, in terms of being able to implement them. So definitely one for the future. First of all, we need to make sure that what we're doing is feasible in the home environment, and once we show that it works and that people are accepting of the modifications that we suggest, I think that we wouldn't limit ourselves with how we could apply this in the future, and certainly care homes is the logical next step. Yeah,
and I suppose particularly in the current situation and context, it is possibly all the more difficult to make any of those adaptations to the care home setting. Yes. We've got lots of questions coming in, and I don't think we can answer all of them, but I think one thing that's really important to highlight, and I made a note of that myself, and looking at the potential inequalities that adaptations in terms of accessing these adaptations in the home as well. And Dorcas put this question here, that we need to be mindful of the costs if these home modifications are approved, and would CCGs or councils be covering those costs, or what are the processes in getting these adaptations?
So the process of current home modifications is quite complex. So the process of delivering current home modifications is quite complex from my perspective, for someone that's just working out how these things are actioned in terms of full services liaising with the council services to implement changes that are perhaps under £1,000 versus those that cost anywhere between £5,000 and £30,000. So in our minds, the visual cues that we've developed can be quite cost effective because we can create them by just painting them on a surface, or by creating stickers that can be applied to the surface, rather than having to go in and modify the environment by removing an object. Or I don't know, for example, you could say the only alternative to walking up and down the stairs is to add a stair lift to the home. So and that, it can be £30,000 to have that modification. So there are, the other alternative is that people live on the lower floor of their home and not use the stairs at all. So we think that we can be in the sort of ballpark of the number I cited from the New Zealand study, which is around £300 at the most for these modifications in the home. But we certainly don't see that being at the expense of the home user. And I think initially, from a research perspective, working with the National Institute for Health Research, if we're successful in that bid, then the cost would come directly from the research fund, and then we'd look at avenues in which we can make that cost effective in the future, especially for those that that live in areas that have high health inequalities and poor housing stock.
Yeah, okay, great. So we've covered a lot here. There's lots more interest in the chat and great talk, compliments here, and also some link ups with clinicians. So we'll follow that up after the talk.
Fantastic.
Thank you, everyone, and thank you very much, Richard, for this talk. Interesting to see a different side than what we usually hear about. So that's and it's important to discuss the implications that has really for everyday life, all the people living at home. Yeah. So thank you, and thanks everyone for listening and joining in. If we could move to the last slide, just sharing our next free webinar, which will take place on the 14th of July. And I've put the link in the chat as well, but it's also on your screen now. And we will be hearing from Dr. Bram de Boer from Maastricht University in the Netherlands. And he will be sharing some of his team's research into the experiences of care home visiting during the pandemic in the Netherlands, but also more broadly. So please sign up again, and looking forward to seeing you then. Thank you, everyone.